Senator Sanders, do you sometimes feel like the last survivor of the private option? You got your co-architect, Representative Burris, gone. Andy Allison, the helpful Human Services official, gone. Governor Beebe will be gone. Your buddy Dismang, Senator Dismang, is otherwise occupied running the entire Senate. You're right there at the vortex on the big issue of this session.
Well, look, it is a big issue, but no, I mean, I think if you look at what has transpired both in the regular session in 2013 and the budget session in 2014, no, I think you have a good team. I think there's a solid core of individuals there who have supported this, and you know, looking forward, looking ahead, we always knew, even as far back as 13, to say that that's far back, that each time that we would come before the legislature, getting reauthorization would be tough. But as you know, you've written, and a lot of viewers of this show have seen many times, you know, this policy isn't one where we have laid concrete, put the rebar down, and put walls up.
Okay.
We're molding it.
We're going to get to the policy, but first to the politics.
Yeah.
You do have a nice group of people who have supported it. Many of them are gone. We had an election. Is it not fair to say that if you actually kept faith with what the voters of the state appeared to say in recent primaries and in the general election, you would abandon the private option?
I don't think that you would abandon the private option. I think what you would do is you would look around and look at the fact that I was up for election. I didn't have a Republican primary and I didn't have a Democratic general election. You can look at someone like Sue Scott from Rogers who survived a Republican primary. And then you can look at the new delegation from Fort Smith, both on the House side and in the Senate. Jake Files, and then of course you've got Matt Pitch over there. These guys support the private option, and you've got other incoming members of the legislature that support it. Jana De La Rosa. There are people on the Republican side that support it. The thing is not so much to focus on the actual policy as it exists today, but the goal, and that is the proliferation of coverage. So I would say this: if you lock in on the policy as it is, yeah, then you could be discouraged. But if you look at where you're trying to drive the train, and that is to reform health care in the state of Arkansas, in spite of what's happening outside of these borders, but to do what's best for Arkansas, and you have had the conversations that I've had with members who have voted against it, some of whom have been vehemently opposed to the policy, but understand better where we're trying to go, I think you have no reason but to be optimistic. You
and I have had this kind of conversation, and I understand it. We're gonna get to it. That it's a fluid issue about reforming health care, and it abounds with conservative principles. I know all of that. But as a conservative, and even in the new libertarian environment, I consider you a bona fide conservative. Is it conservative to spend this federal money?
Is it conservative to spend it only in a vacuum? No, it is not. But to do it with reforms in mind and to prove what we are proving now, I think it is. So if you look at that very question, conservatives have advocated for the spending of federal dollars on health care offered to poor Americans for quite some time. In fact, we've had one of your favorite Republican governors, Rick Perry in Texas, who proposed this very idea in 2008, before there ever was an Obamacare. Governor Leavitt, a former governor of Utah, then was Secretary of Health and Human Services, proposed this very idea for Louisiana in the wake of Hurricane Katrina, and that is to not segregate poor people and put them into Medicaid, but to take them and make them part of the broader insurance market, because the thought is that as part of the market, they can function, but they can also help to bring down the cost, proliferate coverage. And look, you have in this environment no uncompensated care for hospitals, which, you know, hospitals used to be incentivized to just sort of churn people through and write some of it off, but send their bill to Washington. That's gone. So this proposal, this idea has been proposed in the past, but never attempted, and what we're seeing is that it's actually working.
Let me back up to one thing you said. If you considered the private option a static thing, unchanging, in a vacuum, you would be discouraged.
Absolutely,
Politically,
and I wouldn't support it. Let me tell you why.
You mean you today don't support the private option as it is now?
No, I support it as it is. But again, we tend to think in small increments. We tend to be very transactional in the legislature. We don't think long term. If the overall goal is not to change health care and proliferate coverage, not just in this Medicaid target audience, but in the small business market, but also to improve health care in the self-insured market. That's 63% of the health care market in Arkansas. If you're not looking to shift the entire system to one of openness, transparency, more individualism, more consumerism, then yeah, I wouldn't, it wouldn't be worth supporting, because then what you would have is just another government program with a constituency that's on the program, but constituencies around it that support it. And
the private option
would be kind of locked in.
The private option as it now is, you're proud of, but it wouldn't be worth all this fight if it weren't merely an increment in broader health care reform.
Health care reform, not just coverage reform, but care reform.
Is that how you're going to? Is that how you try to pass it in this legislature? Do you? We hear all this talk about rebranding.
Yeah. It's not enough to rebrand.
It's
not enough to rebrand.
Then what do you have to do beyond
rebrand?
rebranding
is something that you can see through. Rebranding is something that's, it's just sort of, changing the furniture around a little bit, putting new wallpaper on the walls, putting a new name on it.
Or calling it something else.
Yeah, that's not important. What you have to do is have an overall drive to healthcare reform. So I'll say this. Yes, we'll focus on the private option. I think one of the things that happened as a result of the fiscal session is we had the linkage between work and healthcare. That was brought about by the fact that we brought Jane English on board, and she saw it as a mechanism to reform something that has needed to be reformed for years, and that's workforce services. And so the idea is you have some natural linkages taking place. Again, and you may want to get to this later, but I'll tell you now, you've got governors in Utah, Alabama, Tennessee that are also taking our model and saying that we want to build upon it and tie more work incentives and not just work requirements to be punitive, but how can you really help people get ahead?
Senator, here's what I'm trying to get at. The Governor-elect Hutchinson, there's some assumption about how he feels about this, but he's not saying. The whole debate is sort of, it's in a vacuum right now. And I'm trying to get some idea from this point person, prime architect of it, how it gets presented, how it gets couched in the coming session. And I'm hearing you say we're going to talk less about the private option and more about conservatizing health care generally.
I speak for one person and one person only. It's the guy you're sitting across from here. I'm telling you what my goal, my aim has always been. Again, I started looking at health care in terms of public policy when I was a kid. I used to, I've told you this before, maybe even told Roby before. I grew up watching Prime Minister's Questions. I knew what I don't want or I didn't want the American healthcare market to become. That is a single payer system. Think about what's happened just literally in the past week and a half. Vermont has been experimenting and planning a move to a single payer system. That has gone away. I don't think Americans are hardwired for that. So here I'll say this. If you're focusing on the private option, which is primarily to cover people at the low end, then you also have to say, what can we do to strengthen small businesses' ability to offer coverage to their employees? Because the idea is you want these people to move up. And then you have to ask yourself, what else can we do? Say if you're a large self-insured company that offers coverage to your workforce, what can we do to help you out to extend coverage to those employees, make it better? Think about this for a second. If say you're a leading manufacturer in Arkansas, you spent your time optimizing your manufacturing process, optimizing your sales force, getting the absolute best executive team that you can get, and your go-to-market strategies are among the best, and they're talking about you on all the financial services, television programs, Larry Kudlow, you name it, Roby Brock. But then you look at your HR side of the house. You're working with old, outdated models. Healthcare, workers' compensation, disability, life insurance, all those things. So
what in the world are you talking about?
What I'm talking about doing is this. If you look at healthcare, you have to take into consideration all aspects of it. What are you doing to strengthen healthcare for all?
I understand that, but this is the Arkansas legislature, and this is the issue of Medicaid expansion, and I'm hearing you say, for your part, you're going to talk about something much broader, much more far-reaching, and really again, sort of subjugate the private option debate to elemental status.
No, and again, I don't, because what you're, in your question, it sounds like you're saying I'm trying to sort of diminish the private option. I'm not trying to diminish the private option. What I'm saying is there's something much larger that we need to be doing.
Well, are you seriously going to talk about these larger things in the forthcoming Arkansas legislative session?
Absolutely.
Are you seriously going to offer some major package of bills?
Well, so let me say this. First of all,
to help employers with their health insurance plans and small business?
Well, there's policy occurring right now. First of all, if you look at what we're doing through our Arkansas Marketplace Exchange, we're the first state in the union that has pursued as a strategy a bifurcated exchange where you have the shop, which is a small business exchange, and then this individual marketplace, the one that's caused all the trouble. We've pushed that out. We want to focus on small business. How can you help small business offer coverage to their employees? Through a defined contribution plan, which allows a small business to write off the cost of the defined contribution, but also the individual employee the ability to write that off. Again, that is outside the rubric of sort of the Obamacare
So that's already
framework.
happening. You just need people to know and understand
it's
that.
happening, but what we have to do is to drive at that. On the self-insured market, look, we know this. In Arkansas, and Walmart gets a lot of attention. Some of the most innovative things happening in healthcare today is happening in the self-insured markets. These are the big companies or even small companies that self-insure. They buy their own health insurance for their employees. The incentive, you know why that happens? The incentives are right.
Because they save money.
Well, but the incentives are right. So I think what we have to do is look.
By that incentives, you mean what?
Well, I mean, so the incentive is one, to keep happy employees that are healthy and working, but also to hold costs down. So what you've seen.
Well, I thought you were getting into your centers of excellence.
Well, I mean, that's part of it. That's part of it.
Where you don't pay for everything, you pay for the best care or care
Right.
that you've chosen. That's from certain providers, correct?
That's a small sliver.
Can you get that done
of it.
legislatively?
Well, I don't think that's not the overall goal.
Okay.
Not the overall. The overall goal is to take the best. So go back to the private option. What did you say about it? It's this conservative policy.
No, I didn't say it was. I said that you said it was.
Okay. So it's this policy where you take conservative ideas and elements and push them in. Look at this. I'll draw you two comparisons: the state of Vermont and the state of Arkansas. What you saw in Vermont was an effort to take the private insurance markets and make it look more like Medicaid for all, single payer. It's not my words; their words. In Arkansas, what we want to do is at least on the private option side, is to take this sort of government-run program and make it look more like the private markets. Now, a key component, which I will offer legislation on this, and I think it's significant. A key component to any market, two things: the ability to make a decision on price and quality. Healthcare has largely operated outside the bounds of that sort of those traditional market elements. So I think we have to have a more open marketplace where we see, what something costs and what the quality is. What are the quality measures? What are the outcomes?
You're going to have some legislation to make a qualitative assessment of how well a doctor's doing and a hospital's doing?
What we'll do is
that's pretty big.
Have disclosure. So it's not. So
where? By whom?
Well, I think one by providers, by doctors, by hospitals, by healthcare providers.
Of what?
Prices.
Here's the number of patients
prices,
you had,
quality,
here's
from
how
specialists.
Here's how many survived?
Sure. Well, from specialist standpoint, quality measures, the outcomes. How do they range? We have in Arkansas the episodes of care, which we are now compensating doctors on how well they manage the overall care.
We sometimes forget that reform is ongoing.
It is. It's a significant reform, but I think what we have to do is begin to help people understand the care. If we want proliferation of coverage, and we want people to behave like consumers of healthcare, then we have to have, you can have the demand side reforms all day long, which is to give people care, but you also have to have a supply side package of reforms, a good conservative term, where you're making consumers more aware.
You're not just trying to alter the conversation in regard to the private option, you're trying to explode it. Really?
Now think.
This is a lot
folks
of
watching this do not have the privilege of sitting in on conversations that we've had in other places. But to be be honest and fair to me, I've been talking about these types of things for a long time. Probably even going back to our days when I was in your shadow as a columnist at the other place.
You're
but,
about to get out of that, I think, Shadow.
Well,
really,
you always told me I wasn't a good columnist.
As a major policymaker.
But it is much bigger. So you have to ask yourself. So think about this for a second. The governor-elect.
Well, I'm getting to him.
Okay. Well, just think. But the governor-elect campaigned on the idea of how can we strengthen the Arkansas economy, and he's proposed, which I support and supported in the last session too, in terms of the reduction of the income tax rate. We can't get to zero fast enough to make our tax code, more to incentivize businesses to come. We can't become Texas overnight in terms of the tax code. That would be hard to do.
It'd also be mildly disastrous, but that's
what you have to ask yourself from a business and a regulatory standpoint, particularly on those things that I talked about, healthcare, workers' compensation, disability. What can we do from a regulatory standpoint to help Arkansas companies innovate and to help them manage a part of their business, which is what? It's very uncertain. Those costs have always increased. Here's the danger, John. People say, are you pro-business or are you pro-market? I'm pro-market. We could get to a spot very easily, and what I'm most fearful of in seeing America succumb to the push for a single-payer system is not constituency groups lobbying the legislature, but it is big business saying, you know what? I can't manage this anymore. I can't manage my health care. I can't manage my workers' comp.
We don't have all day, but you just 3 or 4 times you've set up Vermont and single payer as a bit of a straw man. I mean, there's no. Where is this great threat to go to a single payer system that you're heading off with these reforms? I missed it.
What I'm saying is this. I think my job as a lawmaker and our job collectively as legislators is to look out for the taxpayer, both in the short term and the long term. And look, any consolidation of ideas, be it in the government or the private sector, I mean, can lead to bad things in terms of government intervention. What I want to do is look at a way where we can sort of create a better market in Arkansas for health care, and it means attacking the public side, the private side, the self-insured side, small business, the individual marketplace, all those things.
And not pro-business, but pro-market. It's an interesting way to put it. Business benefits from market reforms.
My friend Tom Cotton says the same thing.
Really?
Yeah.
Well, I missed that also. But I'm glad that he did. Now, let's get to, we're running out of time for this.
I'm trying to talk fast, like an Aaron Sorkin episode on TV.
I know you don't want to and will not speak for the governor-elect, Asa Hutchinson, but there is no way in the world you haven't shared these kinds of views about what we need to do. There's no way you haven't shared those with him. You've had made these kinds of this kind of analysis in an advocacy way to the new governor-elect, have you not?
Probably not in this manner that we just had here in terms of sort of plotting it. I've had conversations with the governor-elect about sort of the overall goal, overall goals, and what we should be driving at.
As you've maybe not as you've said here, but similar in terms of this. The private option is but an element in market reforms that we need to be pursuing.
Yes.
Now, I know you're not going to speak for him.
No, I'm not.
But what did he say? Can you in any way assess his reaction? Can you give some general, what does he just look at you, or does he go, or what does he do?
People just look at me all the time,
right.
My wife, my children. No. So
he doesn't just look at you?
No, I want to catch it in these terms. I think 2 things. One, we've been part of Republican gubernatorial transitions before. I worked
meaning you with Governor Huckabee.
Governor Huckabee, but I found a front page story that you wrote over the weekend back in '97 where you came in and watched. So
you mean you and I have been, sure.
Yes. We've experienced this before.
Well, of course.
Different roles, of course. I was a sort of a menial intern.
What that has to do with my question, I don't know.
My point is this: there's only so much bandwidth that you can have when you're sort of a governor in transition and trying to put a government together. I would,
You mean
John,
he needs to narrow
I would
his...
be dishonest if I sat here and said, yes, I've had detailed conversations with the governor about these very things and laid out the whole plan. That would be dishonest. I have had conversations with him about these things. But
can you give us a hint as to where he's headed with this issue? Because we know where you're headed. You're going to advocate market reforms and continued reform of the health insurance and healthcare delivery system, of which you consider the private option a mere element which needs to be continued. Is Governor-elect Hutchinson, are you confident that he is going to be an ally in those efforts?
I mean, the optimism that I spoke of at the beginning of the interview, I have. I think that carries through. I think you have to look at Asa Hutchinson as an individual, as an elected official, and how he has functioned. He's always been a reformer. You look when he went to Congress,
from about campaign finance reform,
and was out on the leading edge, sort of almost taking sort of counterintuitive approaches, at least politically, rather than just sort of staking out solid ground of what others, outside folks, would consider sort of the conservative path. The other thing is Asa Hutchinson has always been the type of person who will tell you not really what you want to hear, but what you need to hear. Happened to me at a very young age as a young college Republican. I came up with this sort of harebrained idea that I was going to get all of the Republican presidential candidates that were running for president in 1996 to come to Arkadelphia, Arkansas, to have this big thing. We're going to make this big show of it in Bill Clinton's home state. And I had other elected officials saying, oh, yeah, cheerleading, and saying, you ought to do it. I called Asa Hutchinson, who at the time was the chair of the party, and he said, well, David, do you really think they'll come to Arkansas? Don't you think they need to be in New Hampshire or somewhere else where there are people who are actually going to vote early in primaries? And he was very measured and sort of explained and helped me see as a young child. Okay. But
what is the relevance of that anecdote to this issue?
The relevance of this, one, he's always been a reformer.
I know that.
Two, and he always, I think, always takes a counterintuitive approach to policy and what people would consider a counterintuitive approach. He's very much a realist, and he's not one who is just sort of engaging in superfluous speech and telling people what they want to hear. I think he's very much a details-oriented person. Now, what that means is we, as policymakers who engage in the details of policy, have a very high bar and a high threshold where he's not the kind of governor that you're just going to win over on a political argument. I think he has to see a much larger, broader picture and a much larger
when you have generally outlined to him in less detail what you've said here today, has he poo-pooed it in the way he poo-pooed your Arkadelphia debate?
No.
Okay. And I believe that's what you're trying to say.
Well, yes, and I say that not as looking sort of retrospectively. I think looking prospectively is the.
I'm just trying to use you to get the governor-elect's scoop, yeah, but and you're not going to give it to me.
I don't speak for him. I mean,
I know you don't, but I'm trying
Michael
to trick
Lamoureux,
you into
who's
doing
the chief
it.
of staff. You've got the governor governor-elect who speaks for himself. I would say that he put forward some very clear ideas
in his conversation with you
in the campaign. I think that will carry through, and I think, he didn't do what some did, and that is to come out completely opposed to the policy, which one might argue it might have been advantageous for him to do so at some point, but he didn't. And so I think we have a lot of work to do. I think we're talking about things, as you have identified, things that are much larger than just the private option as a policy unto itself. And I'll say this, what the private option really allows for is the space and the environment to innovate. You don't have what's going on in Georgia or Mississippi, where in Georgia they're telling people, hey, if you're going to come to the emergency room, we need you to call and make an appointment. you have other states where their healthcare assets are strained. Here, our hospitals, our insurance companies, our doctors, our provider groups, all have had space to innovate. Now, the warning to them is don't get too comfortable and don't get too greedy and don't try to sort of play and do what you can to get by. I mean, we already know that on the private option, one of the key measurements is what is the average premium cost per month. It's what's in the waiver. We're around $481. We know that from some of the insurance companies that after the reconciliations are done for the cost sharing payments, which is sort of the copays and the deductibles that we help with, and the premiums, that we're going to get some money back. So that number should drop. That's good. That's good news. But what unfortunately, the rules that Washington gave us with respect to insurance and insurance management, the insurers are almost incentivized, no, in fact, almost, they are incentivized to keep people and to see money flow through their books because they have these things called risk corridors. What we have to do is not only work with the legislature and the governor to see the broader picture, but we have to work with the insurers, we have to work with doctors, we have to work with hospitals, specialists, pharmacy benefit companies, I mean, all the pharmacy benefit managers to see the bigger picture.
Okay, I understand. And you need a lot of time to explain all that you have in mind, but we're probably out of time. But let me see if I can
crystallize.
Try this synopsis on for size. We have a chance in Arkansas to reform with genuine conservative pro-market principles our healthcare system. We need to be about doing that. As it happens, an element of that is that we do need to reauthorize the private option with whatever reforms remain available to us, perhaps having to do with some work issue, work relationship. And you have explained these things or had conversations along these lines with the governor-elect, and he has indicated he's thinking about them. He's pondering them seriously.
That's not really what I said. What I said was I've explained, we've talked about him, I've given you a characterization of who he is, what he's done, and what I expect him to do. And
no, you haven't said what you expect him to do.
Well, no,
in any specific way.
I said, look, you know, the whole story about, you know, who he is and telling the truth, retrospective versus prospective.
You expect him to be thoughtful, to be
yes,
counterintuitive?
Thoughtful, counterintuitive, deliberate, and to do what is in the best interest of Arkansans and the taxpayer. And again, I think that's not only focused in a narrow sliver of time, but long. But again,
you don't want to be in a position of speaking for him or indicating what he's going to do?
I speak for one person and one person alone.
So this is going to be this remains at this point a very fluid, detailed issue.
Mm-hmm. And look, so let's get back to the politics.
Okay, and then we're going to have to quit.
Okay, I think what we have to, two things. One, I think to fellow conservatives, I think we have to prove that we are about the business of reform and transformation of the healthcare system from, you know, the low end to the small business owner to the self-insured company. You have to see it all. I think to our friends on the Democratic side, I think we've proven the fact that we're conservatives and we care about providing coverage to people. The mode is different. It wasn't what maybe they wasn't what they had proposed. It wasn't what they looked at. But I think what you have is sort of an environment of sort of demonstrated trust over a period of time to people both on the right and to the left. I realize that when you inject politics into it, it gets a little messy. But I think if you look at sort of the environment that we have, I think there is an opportunity to get everybody at least singing off the same sheet of music, and in terms of an understanding of what's going on. It doesn't mean that everyone is going to be supportive. It doesn't mean that what we're doing may be characterized in a negative way or by some and a positive by others. But I am optimistic that we have the environment to do it. If it can be done, it can be done here.
Okay. you believe there are people on the more libertarian right of your party who can be made to understand that you need, even if grudgingly, to go along with this private option because it's part of something much bigger and genuinely conservative that we need to do. Fair statement?
I won't characterize what or who they are in terms of their political philosophy. I just think I think they're conservatives who are concerned
I called
about
them libertarian. You
sure,
didn't.
Sure.
Right.
I mean, there's certainly some of those elements, and those are important elements.
But I mean, what you need people to say who have a philosophical aversion, they think, to the private option,
yes.
is that they need to come to grudgingly accept, if it has to be grudging, they need to accept, or they need to understand that this is about more than the private option, but they need the private option to effect the broad transformational conservative reforms.
I think they have to see it as, I think they have to see it maybe as a piece, maybe an essential element for this time. You know, again, so I will say this, the best conversations I had with the governor-elect about health care, it was primarily over the summer when we were talking about state innovation waivers, the 1332 waivers that give states the ability, and now Republicans are around the country are waking up to this. This is the part of the president's health care law that allows you to waive the individual mandate, to waive the employer mandate.
We didn't even get to that, but yeah, there is Obamacare allows for states to do it entirely differently.
Waive the exchange.
Right.
Waive the.
And you want to go in that direction.
Yeah, I mean that, and we've said that for a long time. That's where we started.
You could almost say we're not embracing Obamacare, but we're setting ourselves up to do Obamacare our own different way.
Well, I mean, others have said it, and again, from academics to you know, policy observers, this is the mechanism of the law that allows you to begin the process of undoing some of the essential core elements that have been debated and that conservatives find most anathematic about the law.
So we may have to go along with an element of Obamacare right now in order to undo it later.
But you started by asking, is it conservative to spend this money?
I did.
And the answer is no, unless you're looking to transform the system, which transforming the system means more transparency, more coverage, and to do so in a way that lowers cost and increases quality and gets people engaged with healthcare in many respects.
And adds disclosures about quality of care.
Well, I mean, it's essential. It's essential. If you can't make a judgment on quality and cost, then that's really not a market.